everyone, I'm Dr. Nguyen, Assistant Professor in the Department of Family and Community Medicine, and today I'm here to talk to you about racial bias and stigma with the emergence of COVID-19. So the pandemic coincides with the rise in negative racial attitudes towards Asians, and we hear this through anecdotal reports in the news. So my research team, to try to systematically track and document this, we used Twitter data and collected data from November 2019 to March 2020. And preliminary analysis are indicating that during this time period, there was a 70% rise in proportion of tweets referencing Asians that were negative. And this is in comparison to tweets referencing racial ethnic minorities as a whole. That proportion of tweets that were negative declined by 4%. And we look at social media data because social media and online activities can influence norms and behaviors and activities of people offline and in person. So social context that kind of promotes hostility or a less welcoming environment might encourage discrimination or the tolerance of discrimination. And we know from a risk literature that racial discrimination is associated with a variety of mental health and physical outcomes. So let's follow the scientific community's lead and defeat the virus and not each other. So the WHO recommends a couple of things. So first, not attaching an ethnicity or nationality to COVID-19. And we need to be empathetic to anybody who's infected. We refer to people not as COVID cases or victims, but merely as people with COVID-19. So let's focus on uplifting each other because the public health benefits might be more than we realize. Thank you so much.